All lives matter. Trump 2024.
If you're vaccinated, even if you do catch the virus, quote unquote, like people talk about it in normal terms, you're an overwhelming, not many people do. If you do, you're not likely to get sick. You're probably going to be symptomless. You're not going to be in a position where your life is in danger.
I felt his life might be in danger.
Grave danger?
Is there another kind?
Out of this pandemic. And this brings me to where we are and where we're going to go from here. Since early September, cases and hospitalizations are down now more than 50%. And over the past 2 weeks, cases and hospitalizations are falling in approximately 40 states.
According to new data from the CDC, it shows that there is a significant increase in the number of breakthrough infections, hospitalizations, as well as deaths among the fully vaccinated. Trend that we're seeing play out across the entire country right now. And that trend, according to the CDC, is the rise of both breakthrough infections as well as deaths among people who are fully vaccinated. Specifically, according to new data that was just released by the CDC, whether it's breakthrough infections, hospitalizations, or deaths linked to COVID, they have been on the rise over the last several months among people who have already gotten the COVID vaccine. And the actual percentage of these increases is fairly large. Let's go through them together. According to the CDC's data, back in late June, for every 100,000 fully vaccinated people, there were 12.3 breakthrough infections. However, as of mid-August, which is the latest data, there are now 121 breakthrough infections for every 100,000 vaccinated people. And then, if we look at hospitalizations, back in June, for every 100,000 fully vaccinated people, there were 8.9 hospitalizations. However, as of mid-August, that number increased all the way up to 75. 75 people for every 100,000. And then lastly, in terms of the number of deaths, this number also increased dramatically. Back in late June, the death rate among the fully vaccinated was 0.1 for every 100,000 people. However, as of mid-August, that number has jumped all the way up to 1.1. That is an 1,100% increase over just the course of several months. However, what's really interesting here is, now, technically, this new data from the CDC is not exactly news because for a while now we've known, due to many different studies having been released, that the efficacy of the COVID vaccines are waning over time, particularly when you look at breakthrough infections as your metric. That is, of course, one of the main drivers that's pushing booster shots to be adopted across the country and around the entire world. However, this new data from the CDC, which, by the way, was gathered from the surveillance systems of different states and different hospitals throughout the country, it does provide another verifiable data point which shows a noticeable drop in vaccine protection. Now, in terms of specifically why this drop is occurring, well, according to Mr. Paul Alexander, who was a COVID advisor for the Trump administration, he said that it is very likely due to the spread of the different variants. Here's specifically what he wrote to us at the Epoch Times in an email. The marked pronounced change in vaccine effectiveness is likely due to emergence of the Delta variant as the dominant variant and the waning of vaccine immunity over time. The immunity from the vaccine drops markedly over the few months post-vaccine. The Delta is more infectious, yet far less lethal, but the real issue is that there is a mismatch as the vaccine does not hit the Delta, so there is immune escape. It has effectively failed against the Delta, and the accumulated evidence shows this, whether it's from the UK, Israel, etc. So once infections rise, there is usually a hospitalization curve and then a death curve that follows. Now, it's worth noting that this data is not manufacturer specific, meaning that it is not broken down by Pfizer, Moderna, or Johnson & Johnson. However, according to both studies as well as clinical data that's been accumulating over the last several months, it shows that all of the different vaccines have been declining in effectiveness over time. And we are beginning to see a larger percentage of vaccinated people show up even in state statistics. For instance, officials over in the state of Maryland, they are seeing a sharp increase in the number of deaths attributed to breakthrough cases. In fact, one official that we here at the Epoch Times were able to get a hold of, Mr. Andy Owen, he works with the Maryland Department of Health, and he told us that out of the 190 people who died from COVID between September 16th and October 18th, 60 of them, meaning 32%, were fully vaccinated. Here's part of what he said in an email. Many of these deaths are linked to comorbidities that make patients more vulnerable. This further underscores our mission to maintain immunity by urging all eligible Marylanders to get their booster shots. Keep in mind that as the number of our residents who are vaccinated continues to increase, we expect to see an increase in the proportion of COVID-related deaths occurring in vaccinated individuals. Now, I would like to circle back for a moment and once again discuss that CDC data that we mentioned earlier. because there is something here worth mentioning that we did not mention previously. And that is the fact that according to the CDC data, it showed that in the month of August, according to the official numbers, a person who was not vaccinated had a 6.1 times greater risk of testing positive for COVID and an 11.3% greater risk of dying from COVID. Meaning that although the vaccine efficacy seems to be decreasing over time, according to the official data at least, those who are vaccinated are still better protected than those who are not. However, that doesn't necessarily paint the full picture, because when you break the data down by different age groups, when you take the people who are unvaccinated and break them down by age, it demonstrates how younger and healthy people are at very, very low risk for COVID. In fact, according to this data, which is again from the CDC itself, you can find it over on their website, if you are an unvaccinated 18 to 29-year-old, then you have a probability of dying from COVID that is lower than almost all of the fully vaccinated age groups. And so this data actually showed that the risk of death for young, healthy, unvaccinated people was actually very low. But regardless of this fact, 2 days ago, the FDA approved the Pfizer vaccine for young kids between the ages of 5 to 11 years old. Now, to give you some background on that particular authorization, what happened was that last Tuesday, so about a week ago, the FDA's Vaccines and Related Biological Products Advisory Committee, which is their specific committee that discusses things like vaccines, they held a virtual meeting where they discussed whether or not to authorize the Pfizer vaccine to kids aged 5 to 11 years old. And it's worth noting that although this advisory panel is set to consist of independent scientists, according to an investigation that was led by the National File, they found many, you can call them, possible conflicts of interest, such as the fact that some of these committee members, they've either worked for Pfizer or have very large Pfizer connections. And in terms of what these connections actually look like, well, some of the members on this FDA committee, they include a former vice president of Pfizer vaccines, they include a recent Pfizer consultant, they include a recent Pfizer research grant recipient, they include a man who mentored a current top Pfizer vaccine executive, they include another man who runs a center that gives out Pfizer vaccines themselves, and they include a member who is the chair of a Pfizer data group. Now, the fact that these independent scientists have so many connections to Pfizer doesn't in and of themselves disqualify them from giving their opinion. However, I believe that we as the public, we have the right to know who is making these decisions over in the government and whether they have any financial or, let's say, professional stakes in this matter. Actually, if you'd like to go through the list of scientists as well as their connections to Pfizer, the link will be in the description box below this video so you can actually go through them one by one. Regardless, during this committee meeting, there was a question that was raised regarding whether the benefits of the vaccine outweigh the possible risks for young people. Here's specifically what that question asked. Based on the totality of the scientific evidence available, do the benefits of the Pfizer-BioNTech COVID-19 vaccine, when administered as a 2-dose series, 10 micrograms each dose 3 weeks apart, outweigh its risks for use in children 5 to 11 years of age? Now, that is obviously a very natural question that I believe many parents across this country are wondering. And as a response, Dr. Eric Rubin, who ultimately voted in favor of vaccinating children, he said this.
But we're never going to learn about how safe the vaccine is unless we start giving it.
Let me just repeat that statement for you. We're never going to learn about how safe the vaccine is until we start giving it. That is quite a reassuring statement. Regardless, after deliberation, this panel did in fact vote to recommend the FDA as a whole to authorize these vaccines for children aged 5 to 11 years of age. And again, that was last Tuesday. Then on Friday, the FDA came out and they officially authorized the shot based on that panel's recommendation. In fact, here's what Ms. Janet Woodcock, who is the FDA's acting commissioner, here's what she said in the statement. As a mother and a physician, I know that parents, caregivers, school staff, and children have been waiting for today's authorization. Vaccinating younger children against COVID-19 will bring us closer to returning to a sense of normalcy. Now, there is another step in the process before, very likely, vaccine mandates get rolled out for kids across the entire country. And that final step will likely come tomorrow, on Tuesday, when an advisory panel for the CDC will gather together and meet. That's because, just for your reference, the CDC actually has the final say as to whether the vaccine can be used and in what circumstances. And so now that the FDA has approved it, the CDC must make their decision. And until the CDC makes their final decision, pediatricians, pharmacies, as well as other distribution points, they cannot begin rolling out the vaccine to young kids.